we have a guest from Germany. If you were not a doctor, what would you be? So, what sparked you towards the medicine? Was it a person? Was it a thing?
You have to know how you can get to be doctor in Germany. This is not, if you will be called in the night at 3 o'clock, you must be on top. Never decide that you can get money with this job. Money comes, money goes, I would say. It's not a job.
And at that one unforgettable case which you have faced abroad.
Yeah, maybe we'll read it tomorrow in the newspaper. For the beginners, and so it must be a horror, yeah?
Yeah. How much do you think that gut feeling is important about the diagnosis?
In Pakistan you will find it, I'm sure. India is welcome. Recently I moved out a small Nokia telephone.
Can you please explain about leptin? What is that one specific trait which you look in a great student? Liver transplant is one of the main things what do you think the medicine is going in the Kyrgyzstan, at which level they are?
Yes, that's a good idea.
Hello ladies and gentlemen, welcome back to another episode of Medcast KSMA. Today we have got a guest with us. This is going to be very much interesting podcast. We have a guest from Germany, Dr. Matthias Breidert. How are you, sir?
I'm fine, thank you so much.
How is your journey currently going?
Oh, everything was fine. We arrived last Saturday, and so last week we performed some investigations, procedures, and we had a very good team this week, and maybe we can talk about that now.
All right. So can you please take us through your journey, about your qualifications, about your degrees, and obviously journey in the Kyrgyzstan, what you're currently going?
I'm professor of medicine, internal medicine, and I'm specialized in gastroenterology and also in endocrinology. And my degree I got in 2000. Yeah, so it was my habilitation. We say this was a part of assistant professorship. And after this, I was a long time chief of a large hospital in Germany, dealing with gastroenterology, advanced endoscopy, and also oncology and endocrinology. So a broad field of medicine.
Yeah.
And I came to Kyrgyzstan. This was a part. I changed my position 2022 in Switzerland. I'm since 8 years in Switzerland, but I changed my position again. I'm head now of a hospital, a big hospital in Switzerland. And at this time, I had 3 months free. And in this free time, I decided, well, I can go to Kyrgyzstan because they offered me here time for teaching. This was from the German government. This is called SES, is a senior expert service, and they sometimes say, okay, we need some guys in the field maybe of development of technology and engineers, but also doctors. And in this time, they asked me to introduce here the field of hepatology. So this was the time I came for the first time, 2022, to Kyrgyzstan.
So this is going to be a very interesting podcast. Let's just let me ask you one question. It's a very interesting question. If you were not a doctor, what would you be?
As a young man, you didn't know, because my first hobby was music. I play music still, and I play some instruments, but maybe I play like a professional violin. And even if I came home at evening, I play violin 1 hour. It's like a kind of meditation for me. So I play from the first 6 years of my life, first trumpet, and then piano, and after this also then violin my whole life. So I play now since nearly 60 years violin in my life. Yeah.
Violin is one of the difficult instruments to play,
Yes.
And obviously it's very impressive. So what was that basic spark?
So I wanted to be, this was a question, yeah, it's a question. I played several instruments. I want to be director of orchestra.
Music.
Yeah.
Oh.
Yeah, this was a dream, a long time.
All right. So what sparked you towards the medicine? Was it a person? Was it a thing?
It was, maybe you have to know how you can get to be doctor in Germany. This is not so easy. You must be very good school exams. The school notes must be very good on the high rank. So from 100 people, you must be the number one. Otherwise, you will not get a place at university.
All right.
So it's very difficult. And this time, many people wanted to be a doctor. So I studied first chemistry, and also I get a diploma in chemistry. And after this, there was a time we had to work as a military service, or we can do a service for a disabled person. And they decided to not to go to military service. So I went to a home for disabled person, and this I like very much. So this was my decision to be a doctor. My first decision to I want to be a lawyer. Yeah, lawyer or musician, something like that, but not a doctor, because my father was head of a gynecology department, and I have never seen my father in my life. Yeah, he was always on duty. He was working night, as you know.
Yeah.
Birth not waiting at the day. Yeah, so he was very often in the night out of our home. So, but after this, I felt like my grandfathers, both grandfathers was also doctors. It was a good decision. I never said it was a bad decision. I love my job really much. Yeah, yeah.
All right. So, sir, uh, how do you guide the students? I mean, students, they will have a lot of things in their mind that they want to be
Yeah,
this, they want
yeah.
to be this. No, they want to be this. So, how to tackle such scenarios in the life of a student?
I think this. I think the important questions. Always you have to think about it. That it is a really hard job. Yeah, it's a really hard job, and if it's really for you the right job, because you have to work by yourself. Yeah, you have to reflect first what you're doing, and you must be also strong. Yeah, enough. Not only learning and all the
Yeah,
tools, not important. Yeah, but if you will be called in the night at 3 o'clock, you must be on top.
yeah,
Yeah, and this is not easy for a lot of people. So I think, and maybe if you're not in this kind of mood that you will give everything, yeah, for another person you don't know, then choose something else.
yeah. So,
Maybe you understand it, yeah, because money is not was never for me a reason to study medicine. Never, yeah. I if I think my first money I got is like you earn here in Kyrgyzstan. Yeah, never. Yeah, my first money was I think about 300 euros. Yeah, would say, yeah, and this in Europe. Now it's much better, I can tell you. Yeah, but never decide that you can get money with this job. Money comes, money goes, I would say. Yeah, and
yeah,
if you will be successful, you always will be successful in our job. Yeah, it's not a job, it's a profession. It's something gives you. Yeah, you will get more
yeah,
in the job than you can think later. Yeah, this is so.
yeah. So, I mean, sir, obviously these things need the motivation to do something, a passion.
Yeah,
More than passion, it is a profession.
yeah,
So, what is that specific thing that from Zurich to Nepal to Kosovo, what drives you to work across borders?
yeah. Maybe you said the first time I went to Nepal. This was 2010, and this was a luck. Someone asked me if I want to go to Africa to help some the people or to Nepal, and then I decided to go to Nepal because I have been there. I told you before in 1993 for hiking, and it was such a wonderful country that I decided, okay, then I want to help Nepal people. And I'm also academic person, so they said to me they need also more academic men or something who can practice medicine. So this was a good decision. And yeah, I always have the feeling if I go to these countries, it's this aspect of humanity. Yeah, we all on the same planet, and we share all the same problems. And I have luck that I'm born in a very rich country, and I have so much I can give other people. So I want to share my wisdom, also sometimes my money to other people. That's my way of life.
I mean, that's so impressive. That's so touching. Sir, what's that unforgettable moment or in that one unforgettable case which you have faced abroad?
Yeah, there was one case. It was in Nepal.
So Nepal has
Yeah, this was Nepal.
important.
It was really Nepal. It was a little bit I performed ESCP, one of the first ESCPs in the country there As you know, it's a difficult investigation procedure in endoscopy. Most of the difficult investigation. Today we performed also first ESCP in KSMA. Yeah, maybe we'll read it tomorrow in the newspaper. But at this moment, 20 people were around me in a small room. It was very hot, and we had this very stone in the IBD, yeah, a big stone, and it passed not through to the channel. And I said, "Oh, cut please here," and they cut it too short. So we had a real big problem because we need an emergency tool to remove it out by lithotripsy. And then came a technician, and we put everything together. And 1 hour later, it happened. Everybody was happy and clapping their hands, and it was a very nice situation. Believe me, and I was happy that we not killed the patient and the stone we removed out.
So I mean, if you are reliving that moment, how was it performing an endoscopy in a low budget environment with such people around? Was there any pressure?
Yeah, it's
What was
pressure.
actually going through your mind and your heart?
It's a big pressure. Yeah, we have responsibility to the patient. Yeah, and
Yeah.
you have to do your best. That's in all life. Some things you do best, and it's not enough. Then you can't say you have not done a bad job. But if you don't do it and on the level that you will do everything for your best, and in a underdeveloped country, I would say it's everybody is concentrated, but it's not so easy. People are talking. You see now more and more, making pictures and videos, and the concentration is not enough. So it's for the investigator, is really a big stress. Yeah, but believe me, I'm expert in the field, so I can deal with this.
Obviously.
But for the beginners, and so it must be a horror. Yeah,
Yeah.
it must really a horror. And so today also I said, please move out. Only the people are really have to do something in the room should be there. But I know when I looked around, there were more people also. Yeah, so it's an ethical problem. Yeah, because you do it for the first time under bad conditions. And you should explain it before also to the patient. I told the patient today, you are the first. Oh, it was on Wednesday. I told him, you are the first, probably. And then she looked to my eyes and she said to me, I trust you. And then it's okay. Yeah. But we always have to inform the patient, what are you doing? That's also it should be transparent. Yeah. That you need trust between, yeah, like we're talking together. Yeah.
Patient-doctor relationship has
very important, the most important thing. Yeah.
Yeah.
Because if something failed, yeah, and you have explained everything, the patient will say, okay, doctor, you have done a good job. It's not your mistake. Yeah, yeah, very important.
So, sir, I mean, you have studied medicine, you have studied emotion with the diseases. How much do you think that gut feeling is important about the diagnosis? That I have this gut feeling, this is this. I have gut feeling, I have to do this. Do you think is it important that you have to go through the same procedures and same protocol?
If you are treated by a doctor who don't believe this and you do a good job, you're also happy. So my opinion, I believe on God. If this is a question, I believe something is there. So if you believe on Allah, believe in Jesus or what else, yeah, I think this is always the same at the end. But knowledge is better than the stomach feeling. Yeah.
Yeah.
And so I don't say that I don't believe it's very important that quality comes always first. Yeah. Quality and knowledge. And if you are a good doctor as well and have a good ethical basement, yeah, then is everything on the best.
Yeah.
Yeah. It belongs together. But to find a doctor who has a good knowledge, yeah, he knows his skills and maybe can inform you in a good way and maybe had all the ethical basement. This is not easy to find, believe me.
Yeah.
But every student should think that I want to arrive these steps.
Yeah.
Yeah. But first step is knowledge.
Obviously. Yeah.
But the other skills, the so-called soft skills, are also important. But before the soft skills, knowledge is much better. Yeah, yeah.
Yeah. So, what is that weirdest thing which you have found during an endoscopy? I mean, you were doing an endoscopy and you just found, you said, oh, okay, that's interesting.
Yeah.
So, is there any experience?
Oh, yeah. Yeah, so once time ago, I find a worm in my IBD the duct. So that you're looking, or what is this? Yeah, and it's
Worm?
yeah, you took a snare and you put a worm outside. Yeah, it's mostly Chinese. It's how do you call it? Chinese yellow worm. Yeah,
Oh.
yeah. In Pakistan, you can find it. I'm sure India is welcome. Or in Africa. Yeah. Yeah. So also some funny stores. Also maybe you have some foreign bodies in the stomach. Yeah.
Yeah.
Yeah, this is very common, yeah, because on patients with psychiatric disorders, yeah, mental disorders, sometimes they eat everything,
Yeah, anything they
and
can.
it's have a lot of potpourri of everything you can find, yeah,
Yeah.
knife, fork, what else, yeah, yeah, I put out telephone. Recently, I moved out a small Nokia telephone. It was small size like this, yeah. And we put out, and it worked when I put it out, yeah. Yeah, believe this was crazy situation, if you ask me.
Oh, it's
It's funny, yeah.
yeah, it's funny and fascinating at the same time. All right, sir. Sir, you actually dedicated your years of life to leptin.
Oh, that's
Tell
lovely.
me through the journey. Take me through the journey
Oh,
about the discovery and all the stuff you have done.
oh, this was a long time ago. This was in the time I was working in the field of endocrinology,
Mm-hmm.
and I was at university. It was University of Dresden. It's a wonderful city, a nice place, and I I I read a newspaper. This was a very renowned newspaper, and they said, "Oh, we found leptin in stomach of mice." And I said, "Okay, well, if it's mice, I can find it also in human." This was the idea. I took all my biopsies. I had a big biobank at this time from gastric cancer. I took all my biopsies. I took a flight to America, to NIH, to Bethesda, and there I found the leptin in the stomach of its patients. Yeah, and this was a big story at this time. Yeah, because nobody found it in the stomach, and I was the first who found it in the stomach. Yeah. After this, we had also some ideas of electron microscopy, and we could show that this also in electron micros with a gold electron microscopy we can show that there's leptin in the mucosa and so on and so on. This was a story as leptin.
Uh,
Was the basic of my professorship, if you
just
say.
a moment. For the audience, those who do not know much about medicine, can you please explain about leptin a little bit?
Leptin is the most important hormone. It's produced in the fat cells and gives the communication to the hypothalamus to induce food intake. Yeah, and it's a direct relation with food intake and the level of leptin of producing leptin. And there are other hormones working in the hypothalamus, as you know, HPY and other proteins. So it was at this time very important to develop these systems. Yeah, how food intake is controlled in your brain. Yeah, this is brain disease, we say. Yeah,
Yeah,
yeah. Diabetes is a brain disease at the end. Yeah, not the problem of not much insulin or enough or what else. Yeah.
yeah. Actually, sir, our major majority of the audience, they are the students. So,
Mhm.
what is that one specific trait which you look in a great student?
What do you mean? Do you mean that's what they
What makes a student a best student among all the students?
the best students? Best students can work in a team
Ah,
because medicine is teamwork. Not only thinking for your own. Yeah, yeah. Maybe you share your wisdom. Yeah, this is important to learn together and discuss together. Yeah, and then you find your way. What is your interest? But because maybe you need, if you will be a surgeon, yeah, maybe you have not the knowledge of internal medicine or what else, ophthalmology or what else. So it's important to discuss this together and work as a team, and because teamwork is the point of excellence. Yeah,
Yeah.
operation without a team today, yeah, you're nothing. Yeah, you're only as good as your team.
Yeah. And sir, moving towards the end of the podcast, what is that mentor which actually motivated you? It can either be a book, a person, anyone, but what do you call your mentor in your life or in your journey?
Yeah, some person maybe you don't know any longer. It was one of the greatest humanists lived in this world. Also Nobel Prize winner. It was called, his name was Albert Schweitzer. He was a German French man. Yeah, and maybe you have known he went to Africa and built up the first hospital in Africa, in western part of Africa, for the poorest people. And he was also a great musician. He was Protestant, and and also medicine. He was a really great person, and still maybe a lot of people, also our country, thinks this is really uh, someone we can follow still. Yeah, Albert Schweitzer. Don't
Yeah.
forget this name.
All right. Sir, as you already mentioned that you had a lot of interest in music,
Yeah.
are you one of those persons who are, I mean, in an operation theater or during an endoscopy, listening to the music?
Yeah,
Or
it's a good question. Sometimes we have done it, but the concentration goes a little bit down. Yeah.
ah,
Yeah, I like it, but I also like to talk with my team. Yeah, so we're talking about many things. Yeah, how it was a holiday, it was what happened with your child. So
oh,
you believe me, during endoscopy, it's not every time it's so interesting. Yeah, it's also
yeah,
it's routine work. So we are
yeah.
talking about simple things. Believe me.
All right. And now towards the end, about in Kyrgyzstan, as you already
Yeah.
mentioned that you are currently working with the hepatology, etc. Liver transplant is one of the main things which is not been done in Kyrgyzstan.
Hmm.
So uh, it is pretty rare. What do you think the medicine is going in the Kyrgyzstan? At which level they are? And what do you think endoscopy and obviously all?
Difficult question. First, I think now I have only the experience over the last 3 years. Yeah, in the
Yeah,
last 3 years, there's here in the KSMA, I think that it's going very good on. So I want to see if I look to the endoscopy department now I created and we opened last year, we had a big advantage. So we perform at a good level endoscopies now. But as you know, system is here a little bit difficult. Yeah, you have a private system and you have
yeah,
a governmental system. And I think the quality now, and this is my hope, will be for all people here and not only for the rich people, but also for the poor
yeah,
people. So this is one of my motion, yeah, motivation to come to this country to develop this system also at the university here. And I think all people are doing a very good job here. And I think in the future, for example, for endoscopy unit, I think it needs more than 5 years. 5 years we will be a very good level. For example, this year we will send all two guys to doctors to Nepal for our light tower center.
oh,
There's a really light tower center for whole Nepal. All people coming to the center, and we will train now the people from here at Nepal. And I think the network is important, not only looking to America or Europe, what else, yeah.
yeah.
There are other centers in the world, yeah, and I think the development will go step by step, and also in the country, I am sure, and everybody's on a good way. Also for the students here, hopefully, yeah.
Yeah, hopefully we are going moving towards the right direction.
Mm.
Thank you so much, sir, for being on the
Yeah.
set. It was very interesting to have this podcast. And just last question about that, about your collaboration with the KSMA currently.
Mm.
When has it actually started? How is it going? And how do you foresee this collaboration with the Kyrgyz State Medical Academy?
As I said before, I started 2022. I
Mm-hmm.
came every year, sometimes twice a year. and next time I will come next year again. Um, I'm not alone. I'm also a team because I'm vice president of the Gastro Foundation, and who's supporting this department now of endoscopy. And next in 2 weeks, the next colleague will come from Switzerland, Kaspar Doninger, is also very very renowned person in endoscopy, in the field of endoscopy. In October, head nurse of University of Freiburg will come from Germany, and so on and so on. We are a team, and we are all becoming more and more. Yeah, I was the first. Mostly, I make the way free for
Yeah,
everybody else. So, but alone, it's not possible to come to the next step. So, more people will come, and
teamwork.
we will make also exchange. If it works fine, uh, Kyrgyzstan doctors we will bring also to our countries. Yeah.
Oh,
This must be an exchange. Yeah,
so we are hopeful for a better future.
maybe the future will be fantastic. Yeah,
Yeah.
I'm sorry. And Kyrgyzstan is a very nice country. I love it very much. It's as you know, we say here it's like the Swiss in Asia. Yeah. But Nepali people say it's the same, so a little bit difficult maybe. Yeah, we have to divide it more.
Yeah. So it's the Switzerland of the Central Asia.
Yes, that's a good idea.
Yeah. So
So
Central Asian
we
Switzerland.
come to an end. This.
Yeah. Thank you so much, sir, for being on the set. It was very interesting to have a talk with you.
For me also.
Again, thank you. And at last, if you have any message for the audience or any message for students of KSMA,
Yeah, try all the days your best and believe in you.
thank you so much.